Hey everybody, welcome this week to our first weekly live stream. We're calling The Review. I'm so excited to be joined this week by my senior policy advisor, Paige Hodder. Paige, welcome to the show.
Hey, Morgan.
All right, so for those who are just tuning in for the first time, this is our weekly live stream where we're going to talk a little bit more about some of the news that's on the headlines and is being most discussed this week in Ohio and across the country to be able to bring you up to date on what our campaign's working on and what the State House overall needs to be doing to get things right. So this week we're going to be starting off by talking about the lockdown measures that have been slowly lifted, Ohio's stay-at-home order with some new developments over the last couple of days to remove some of those points. We're going to talk about why those particular stay-at-home orders were so effective in squashing the curve and how they could have been even more effective if we'd done them earlier. And we're also going to talk a little bit about how we can continue to reopen Ohio's economy, but keep the public health in mind first and foremost. So, Paige, do you want to break down a little bit about how we can or what some of the things over the last week we've seen in regards to reopening, what's happening today, and what is now open in Ohio?
Yeah, so the biggest reopening we had was last Friday when bars and restaurants opened for outdoor dining, which is a really big deal. I know a lot of people were really looking forward to that. And that was compounded by the fact that today, indoor restaurants and dining are actually opening along with campgrounds. Like in the next few days, um, activities such as horse racing, gyms, and pools are opening, and then finishing with on the 31st, childcare being reopened.
Yeah. So that's a pretty quick timeline overall on what things are going to be coming back open that have been closed for a couple months now. One of the things we saw yesterday that I want to be able to highlight in this kind of conversation is the fact that overall we've seen that lockdowns as a whole have been not only incredibly effective in flattening Ohio's curve. We've hopefully seen some of the slower infection rates that could have been possible on the fact that if we'd let things just run rampant and we hadn't done the measures that we had done, we would have seen much larger breakouts in similar to places like Michigan and others where the spread has been much more viral. So we've avoided some of the worst parts of this. However, the New York Times came out with a piece yesterday that highlighted some data from Columbia University, which showed that if we'd instituted social distancing rules just a week earlier, we could have avoided an additional 36,000 deaths by May 3rd, which is an overall staggering figure on the fact that delays and the lack of guidance from the White House's and overall function of what the president should be leading us on could have saved more lives and we could have done more. So now that we are reopening and we're doing some things, what kinds of measures and things should we be focusing on to be able to make sure that we're keeping people safe?
Yeah, so the number one thing is, of course, making sure we are following the rules that the governor is setting out for us. That just because some things are open doesn't mean it's a free for all and that things are going back to normal. We saw earlier, like I said, when outdoor dining reopened, some bars and restaurants and some people decided that that meant they didn't have to follow the social distancing guidelines and restrictions as much as they probably definitely should have. But the good news is we did see Governor DeWine talking about how he is aware of that problem, how that was a big problem, and that he is dedicated to making sure that people are following the strict guidelines that have been set out as we open up the economy. Obviously, we want to open up the economy, but like making sure we do it in a safe way. And so making sure that like if restaurants, bars, especially as we move into indoor dining, are not following, the every other table, certain capacity rules, that they will be getting citations and such as like removal of liquor license and stuff like that, because by doing that, they're putting people's health at risk, and that needs to be taken seriously.
Yeah. Couldn't have put it any better than that. I think that there's a hope amongst all of us that we can get back to our normal life as quickly as we can, and everything will be back to the way it was. But we have to acknowledge the fact that the virus hasn't gone away. We're still seeing infections. People are still losing their lives from this, and it's still a deadly threat each and every day. We had in Lebanon last week. Real proud of my sister. She graduated from high school, and we had an event to try to commemorate as much as we could those who graduated from the class of 2020. Now we can't do the normal kind of graduation ceremonies you would see around this amount of time in the University of Dayton's Nutter Center, but you did see instead the fact that we were able to do this kind of like parade item where we all got together and we drove from the school to school. And we were supposed to stay in our cars. We're supposed to follow all these directions. We're supposed to have administrators from the school working with people to make sure that they all stayed in their cars and didn't mix and mingle. But it showed as a bit of a microcosm how difficult it is to make sure that we enforce these kind of social distancing standards if there isn't that lockdown or that stay-at-home order that's in place, because we had so many people, dozens of them walking around and just being able to embrace and take photos and all these things we want high school students to be able to do. We want them to be able to celebrate the fact that they graduated, but that we have to stay concerned about the fact that that event as a whole may have caused additional spread of the virus, and with such a high mortality rate compared to things like the flu, it's still a deadly threat out there. So it sucks. It really does suck to watch
Yeah.
the fact that we can't go back to where we were.
And yeah, like that's something that I think it gets acknowledged, I think, less. And that is the fact that staying home, practicing these things is it's not to protect us, it's us making a sacrifice to protect the people who are truly vulnerable. And like I can't even imagine, as someone who got to enjoy my graduation to the fullest, I cannot imagine having to be told that I wouldn't. But I think it is an amazing sacrifice that the class of 2020 is going through right now to truly make sure that our society as a whole is safer and more healthy. And I commemorate them because they're doing it. And I mean, most of them are doing it without a whole bunch of tears and without complaining because they know it's the right thing to do.
Yeah, yeah. It's honorable to see the fact that there's so many people that have taken up the call to do what's right overall. We still see people that are attempting to avoid public places, and people who are following the mask rules. But one of the things we saw yesterday in the Ohio State House and the House of Representatives is that the House Democrats put together a very simple proposal that it should be, at the very least, mandated that all state representatives, if we're going to continue having the legislature be open and we're going to continue to have them do work, that both for the safety of the staff and the legislators, that they should simply wear masks. That it shouldn't be that hard of a thing to do. It should be the very least of what we ask our representatives to do is to wear a mask for a few hours. I know I do that all the if I'm ever going out for any reason, always to wear one of those. And so I fundamentally don't understand sometimes when we have our leadership is willfully choosing to ignore the scientific evidence that is and the guidance from places like the CDC and the Ohio Department of Health, which is showing us that masks and other basic social distancing functions are still needed.
Yeah, and that's I think a similar situation where we know that me wearing a mask is not to protect me. It's not to keep me from getting sick. It is in case I have it, so that I do not give it to people.
Exactly.
In case I have it and I'm asymptomatic. And so again, it's that sacrifice. It's understanding that like it's gonna be a little hot and stuffy. My glasses are gonna get fogged up, and that's gonna be a bummer.
Yep.
My nose is gonna be all red because it's been rubbing on the mask. But like, I mean, no one died. So, and understanding that like, I mean, not all of the legislators are all that youthful. So like they in some ways represent a higher risk group. And so like obviously we don't want to put our government at risk in that way. And like you said, leadership. Like we're looking to see our leaders trust science, trust the experts, and really, lead by example. Say like, yeah, it's kind of uncomfortable. Yeah, I didn't really sign up to be wearing a mask for the rest of my life. Like I didn't expect that. I didn't, this is not a future I saw for myself, but like it's showing maybe the people who are more hesitant, maybe the people who are like, I don't really understand why we have to, that is a necessary part of reopening the state in a safe way and continuing normality, but in a safe way.
Yeah. We're all going to have to make sacrifices of some sort over the coming months and maybe years until we have that vaccine that can hopefully prevent this from further spreading. So I think that's a good point for us to end on. Thank you, Paige, so much for being a part of this, and for everybody for watching. This is going to be a weekly item. Hopefully, we're able to do it on more platforms as we go forward. But thank you so much for joining, and I hope to see you next week.